Hi, I'm Maddie, and this is Practice What You Post. I want to start this first episode by telling you why I made this show in the first place. Because I think that there is a version of a podcast for allied health professionals about social media it's fine. It tells you what to post, maybe gives you a content calendar, and talks about how to go viral. And that's not what this podcast is about. This show exists because I genuinely believe that how allied health professionals communicate online matters way beyond your clinic. It matters for public health. It matters for the quality of health information that people are navigating every single day. And it matters in ways that most of us were never really taught to think about. So that's what we're going to talk about: health communication, health promotion, what it actually means to show up online as an allied health professional, and why that's a more interesting, more important question than what should I post on a Tuesday? Welcome to Practice What You Post. Let's get into it. Okay, before we get into anything else, I want to paint you a picture. Let's say a patient or a client comes in to see you. It might be for physio, psychology, nutrition, or any number of things. And before they walk through your door, before they even booked an appointment, they probably spent some time online, maybe looking up some symptoms, reading about some concerns, watching videos, scrolling through Instagram, TikTok, maybe even YouTube, or posting in Facebook groups. And now that's not unusual. That's just how people navigate health now. And the thing is, the quality of what they found before they got to you varies enormously. Some of it may have been accurate, evidence-based, genuinely useful. Some of it may have been less so. And some of it may have been actively harmful, things that made them more anxious, more confused, less likely to follow through on seeking support, or even trying something that may not actually help them. And by the time they're sitting in your treatment room or your clinic, they've already been communicated to about their health a lot by a lot of different sources. And some of those sources have an agenda that has nothing to do with their well-being. And that is the information environment. And your clients and patients are inside it constantly, whether you engage with it or not. And the question isn't whether the information environment affects your patients or your clients, it's whether you are part of the conversation. Here's where it gets interesting for allied health professionals who are online. Now, when you post on Instagram or TikTok or wherever you're creating content, you're not just doing marketing, you're participating in that information environment. You are one of the sources that your clients and patients, and even potential patients, and also even total strangers, are encountering. And that's a big deal. And I think that understanding that changes how you think about what you post and why. And when I think about what we're all doing when we post on social media, especially for clinicians, health communication is the right lens to go down. Because here's the thing about health information online: it doesn't just inform, it shapes how people understand their health. It influences what they think is possible. It affects how much trust they bring into a clinical encounter. It tells them implicitly all the time who to listen to and why. And the research on this is genuinely fascinating. People don't evaluate health information the way we might think. They're not primarily fact checking. They're asking, does this person seem like they know what they're talking about? Does this feel right to me based on what I already believe? And can this person help me? Your registration at its core is a trust signal. Your professional identity is also a trust signal. The way you explain things, the language you use, the questions you answer, all of it communicates something about who you are and whether you can be believed. And that is something when we are looking at the health information landscape. This is something to keep in mind when posting on social media. And you don't have to have a public health degree to be a health communicator. You being an allied health professional with a public online social media presence, you do end up communicating health information online. I also want to introduce another term that's going to come up a lot in this show: health promotion. So, health promotion has a pretty specific definition in public health, and the World Health Organization describes it as the process of enabling people to increase control over and to improve their health. It's about going beyond treating individual illness, it's about the conditions that make health possible in the first place. Now, that might sound like it's only relevant to big picture public health work, so policy, population health, government campaigns. And health promotion absolutely operates at that level. But it also operates at the individual and community level. And I'd argue that's what you're doing when you create content as an allied health professional, especially content that helps people understand their health, that gives them agency, that meets them where they are. That is health promotion work, even if nobody has really called it that. And one of the things I find most useful about the health promotion framework is that it takes seriously the idea that information alone doesn't change health. If it did, we'd all be exercising regularly and sleeping 8 hours and managing stress quite easily, because we know that that stuff matters, but knowing isn't the barrier. What actually shapes health behavior is a lot more complex than that. It's the environment, it's access, it's social norms, it's trust, it's whether people feel like they can access something to improve their health. It is equity. And health promotion thinks about all of these things. And when you create content that's not just informational, but can actually help someone, that helps someone feel capable and supported rather than just more worried or more overwhelmed, that is health promotion in practice. And that is the standard I want to uphold across all allied health professionals online. Not is this content technically accurate, although that matters, but is this content actually useful for the people on the other end of it? We're in a health information environment that honestly is quite chaotic. The volume of health content online is enormous, and the quality it can be quite variable. And the things that tend to spread, the things that get the most engagement, the most reach, are not necessarily the most accurate or the most helpful. They're often the most emotionally activating, the most alarming, and generally validates what people might already believe, and misinformation spreads faster than correction, and wellness culture fills gaps that healthcare hasn't filled, and people are often navigating genuinely complex health situations with information sources that have completely different incentives to the healthcare system. Allied health professionals showing up online with evidence-based, accessible, humanized content, that matters in this context, not in a grandiose way. I'm not suggesting that we're going to fix all of the health misinformation, but we can be a part of the information environment our clients, patients, and communities are navigating. We can be a source of trust. We can model what good health communication actually looks like. And one thing I don't want to gloss over is that health professionals online can also contribute to the problem. Sometimes allied health professionals use their authority to push things that aren't exactly evidence-based. Sometimes they also might seek social validation by posting things that might actually harm the person on the other side. And I think that that tension is worth sitting with, is that we all have influence, and what we do with it is something to explore, because influence without reflection is just noise with credentials attached to it. So here is what Practice What You Post is going to be about. Each episode, we're going to take a concept from health communication or health promotion, something with research and theory behind it, and we're going to work through what it actually means for allied health professionals who are online. We're going to talk about how the information environment works, about trust and credibility, about why people do and don't engage with health information, about the wellness industry and what it means for our professional credibility, about health equity and whose health we're actually promoting when we post. I'm going to try and make this genuinely interesting, but I think I want to focus on a conversation about the work we're all doing and why it matters. I'm going to be honest and upfront. I'm not going to tell you about what to post. I'm not going to give you a content strategy or a formula. What I do want to do is give you a way of thinking about the work, a framework that you can apply to your own practice, whatever that actually looks like. Because I think that when you understand health communication, when you actually understand why things land or why they don't, what trust is built on, what your professional voice can do in this landscape, the content decisions become a lot clearer. They become a lot more intentional and honestly a lot more interesting. And I think it also takes the pressure off trying to just go viral. That is what practice what you post is going to be about. Thank you so much for listening to the first episode of Practice What You Post. I'm genuinely excited about the conversations ahead in this season, and I do hope that you stick around. A quick note on how the show actually works. So, new episodes come out fortnightly, and you can find us wherever you listen to your podcasts. You can subscribe to our YouTube channel so you don't miss out on an episode. And if you found this useful, share it with a colleague. That is genuinely the best way to help this show grow. Next episode, we're going into health promotion a little bit more, specifically what the health promotion framework means for how you think about your content and your communication. It's actually one of my favorite things to talk about, and I think you'll find it really useful. But until then, take care of yourselves and keep practicing what you post.